Hello, today we are going to know about extracorporeal membrane oxygenation and care of patient on extracorporeal membrane oxygenation. Extracorporeal membrane oxygenation is also known as extracorporeal life support that provides the heart and the lungs of the person who are unable to get adequate amount of gas exchange and perfusion to sustain life. Extracorporeal membrane oxygenation removes carbon dioxide and sends oxygen-filled blood back to the tissues in the body. Extracorporeal membrane oxygenation is used for the patients of acute myocardial infarction, that is heart attack, acute respiratory distress syndrome, coronavirus disease, decompensated cardiomyopathy, myocarditis, cardiogenic shock, pulmonary embolism. The most common risk factors that occurs during the patient is on extracorporeal membrane oxygenation are bleeding, thromboembolism, coagulopathy, infection, seizures and stroke. Extracorporeal membrane oxygenation is contraindicated in patients which are having limited vascular access, inability to accept blood products, severe coagulopathy and severe brain injury that is irreversible or untreatable metastatic cancer. Extracorporeal membrane oxygenation are of two types. First one is veno-venous ECMO and second one is veno-arterial ECMO. The benefit of extracorporeal membrane oxygenation is providing biventricular support to the heart. The drainage cannula is situated at the femoral vein. The oxygenated blood flow of ECMO machine is controlled across hollow fiber membrane. As we have known about few points related to extracorporeal membrane oxygenation, now we will move towards the care of patient who is on extracorporeal membrane oxygenation. As the patient is on ECMO, the first parameters to monitor are vital signs, heart rate, mean arterial blood pressure, temperature, oxygen saturation, central venous pressure. The physical assessment including hyperperfusion signs, sweating and moisture level, neurological status including consciousness, pupillary reactions, peripheral and central cannulation methods are used to place a patient on extracorporeal membrane oxygenation. The ECMO blood flow rate for an adult should be 4 to 6 liter per minute, that is 60 to 80 milliliter per kg per minute. When the patient is on ECMO, the level of FiO2 should be less than 50% with reasonable positive end expiratory pressure level should be less than 10. The cardiovascular system of patient on extracorporeal membrane oxygenation is managed by maintaining systemic perfusion and intravascular volume. The respiratory system of ECMO patient should be maintained by maintaining airway, oxygenation and ventilator settings with providing oral care and tracheal site care. The risk for skin breakdown and imbalanced lung function will be managed by keeping patient clean, dry with pressure relieving devices and continuously monitoring ET tubes, chest tubes and cannulas. The negative pressure in the cannula should not exceed more than 100 mmHg. The positive pressure in the reinfusion cannula should not exceed more than 200 to 250 mmHg. Patient on extracorporeal membrane oxygenation having urine output less than 0.5 ml with positive fluid balance more than 500 ml in the past 24 hours should be started with renal replacement therapy. 3C rule action during the process of decannulation. Those are clamp, call for help and compress. The most common medications offered to the patient on ECMO are midazolam, phenytoin and morphine. This was short description about concept of extracorporeal membrane oxygenation and care of patient on extracorporeal membrane oxygenation. Thank you.